Good day, dear friends. Denas Corporation is pleased to offer you another new product, an updated, improved apparatus, Denas Vertebrae. We know for over 4 years the device Denas Vertebrae and many users, consumers, and distributors of our company appreciated the ability and efficiency of the device Denas Vertebrae in the treatment of diseases of the spine and other internal organs. And now we are releasing a new device, the device Denas Vertebrae second generation. So let me tell you a little about the merits of the previous model because all of the capabilities of the device Denas Vertebrae were saved in this new unit. Before, the device Denas Vertebrae had only 4 programs. The program A was intended to affect the entire region of the back by the traveling wave. This method simulates the effects of electromassage stroking, massaging, and tapping. This program is designed primarily for the situation when the patient has diffuse disease of the spine but has no acute localized pain. I must say, a lot of people have problems with the spine, and the Program A is designed for the medical and preventative plan for almost all people. The Program B is intended for the treatment of acute localized pain in one or other region of the spine. In this case, by the selection button, Zone Stimulation, we can choose required treatment zone, cervical, thoracic, or lumbar spine. The Program B is the most effective and efficient treatment for acute recent pain. The Program C is for the treatment of chronic, long pain. The pain cannot be so intense, but lingering for several days, weeks, maybe even months. By pressing the button Select Zone, we can also select the desired zone of stimulation, and the unit will conduct the impact on the selected zone. The next program is a Program D. This program is intended to treat pointed localized pain when the patient can clearly specify the location of the pain. Also, we can select the desired zone for stimulation, and the unit will automatically stimulate this chosen area for 10 minutes. In addition, the Program D can be used as feedback to the segmental zones by pathology of one or another internal organ. In other words, knowing the problem, knowing the affected organ, we can impact to affected organ from opposite side of the back. The program will continue to work automatically for 10 minutes. We call this way of working Program D applicator mode. But most importantly, the maximum interest to us in this new model, of course, is the Program E. This is the new 5th program of the unit when, in fact, for the first time, our dream came true, which is called the automatic biocontrol feedback between the body and the machine. In this case, the machine automatically selects the trigger zone and has an impact on it by healing frequencies. Let's take a little more detailed look at the Program E, which consists of 3 phases. The first phase is intended to affect to the entire region of the back by different frequencies of the traveling wave, which conducts a similar impact as Program A. The next phase of the program is the mode test, which has been specially developed and designed for this model of machine, Denas Vertebra. I just want to mention that it was nothing like this in any previous models produced by Denas Corporation. In this mode, the machine automatically evaluates the reaction of the skin from previous stimulation compared to the previous models that just evaluated the original condition of the skin. This phase lasts for 3 minutes at a frequency of 10 Hz. It is the automatic measurement of skin indicators by symmetrical paravertebral areas. The unit automatically calculates the obtained results and selects the area in which the difference between the right and the left side is maximum, which is the latent trigger zone. I emphasize again that this process is automatic and we should not have to apply the electrodes and no need to record and evaluate the obtained reading because the machine will do it automatically. Moreover, it performs several measurements and automatically calculates readings in these areas using these multiple measurements. After selecting the trigger zone, the unit automatically switches to third phase of the program E, treatment. The treatment of this zone for that particular patient in this procedure is to conduct automatic processing of the latent trigger zone. This stimulation works by interleaved frequencies with 10 minutes. Thus, the total duration of the program E is about 37 minutes. At the end of the program, the device emits a beep that indicates the session is completed. You need to use the program E, the fifth program of the device, Denas Vertebra of program E, for back pain. Of course, first of all, it is the stage of rehabilitation. We've got an analgesic effect with the use of previous programs as the program B, C, or D for pointed pain, but we want to improve this effect, improve the overall effectiveness of the treatment. Now, the patient has no specific pain, no specific complaints, but we want to know what exact body zone is responsible for the problem and cause these diseases and pains in the spine. That's why we needed the program E. The unit will automatically find this area and additionally, with the treatment purpose, will process it. For example, the patient had pain in the spine. We remove this pain by previous programs B, C, or D, depending on the intensity of the pain, duration of the disease. It means we blocked and removed the pain syndrome. But the task of rehabilitation is much wider. We have learned to take off the pain, but we don't want this pain to bother us in the near future. We want to change the course of the disease and we want to get influence on the mechanisms of developing pain. And for that, we needed the rehabilitation. We needed to process zones which are compatible for this problem and the mechanisms of appearance, these acute or chronic pain syndromes. In vertebrology, often are situations when the patient pain is localized in one place of the spine, but the cause of this pain is in a different place. How to find it? How to recognize it? Here is a program E which helps us to do so. When we've blocked acute pain or chronic pain, we continue the treatment course of the program E. Then the device will automatically search latent trigger zones and will affect on it individually. For each procedure, these zones may be different with therapeutic purposes. Second, prevention is very important. We all know how important it is to prevent the development of disease or the development of its complications. The prevention is working not only for developing pain spine syndrome. The spine and the innervation are associated with many other problems such as cardiovascular diseases, digestive system, respiratory system, the pathology of the musculoskeletal system, and, respectively, prevention of spine diseases leads to prevention and warning of other internal organ diseases. How to carry out the prevention, which zone is responsible for the problem, which zone is, as we say, weak link. Before, we had an opportunity to search for example by using Denas PCM in-mode screening or test these latent trigger zones, but it is a time-consuming procedure that the patient himself, of course, is not able to perform and needs operator assistance. This would be necessary to write down, memorize numbers, analyze the data, and look for this trigger zone manually. The program E of Denas Vertebra does it automatically and will find this problem zone and will stimulate it in therapeutic purposes. Prevention, of course, is an extremely important process. Third, a very important reason to use the program E is the effects that we're getting by massaging the spine with general regulatory actions and effect. We often use these words in schools and at medical presentations when we talk about the merits of dynamic electric neurostimulation, but we do not always understand exactly what is behind these words, the meaning of the regulation in general. We must remember that our body is organic and any local problems always affect the entire body. And, therefore, we need to treat not only a certain problem, we must treat the entire body, and there is nothing better than stimulation on the back. In the spine are concentrated somatic and autonomic regulation centers, virtually all of the internal organs and all body parts of our organism. Such stimulation allows us to regulate the operation of the entire organism. There is an anti-aging effect, the regulation of vascular tone, and regulation of all the internal organs of the body. In other words, this program works absolutely for all people who lead an active lifestyle and are subject to constant influences of not always favorable surrounding environment. So, by summarizing the therapeutic capabilities of the device Denas Vertebra second generation, I must say that the device helps us to solve the problem of acute and chronic pain syndromes and most importantly, helps us work on prevention, on exacerbation, or the development of acute diseases by affecting on the entire spine. The principle of feedback, so-called biocontrol electroneurostimulation, is that we have finally managed to fully implement this in the new fifth program E of the device Denas Vertebra. Such program significantly increases the overall effects and the overall efficiency of dynamic electroneurostimulation. Let's carry out the first session on the new machine, Denas Vertebra, in the program E. Well, as usually, the unit must be placed on a flat, solid surface. In this case, it will be a medical couch. Before using the apparatus, the electrodes should be processed by standard disinfectant solution, for example, 3% solution of hydrogen peroxide. Also, it's necessary to cover the device by a special cloth with holes for the electrodes, so the machine is ready for use. Next, we put the patient down on the device by the method rolling. Not every patient can lie down flat from the sitting position on the device because there is pain and some discomfort. But by the method of rolling, almost anybody could make it. It is necessary to place the patient so that the neck electrodes are positioned below of hair growth on the back of the neck. Small roller can be put under the patient's head for his convenience. Next, we turn the machine on and, by the button Program Selection, select the desired program stimulation. In our case, it will be the program E. Select the required power stimulation. Do not forget to ask the patient how he feels during treatment session. There is supposed to be non-irritating, pleasant, and comfortable tingling. The first phase of the program E begins when the unit, by combining and alternating frequencies, will run for 23 minutes. Then automatically starts the second phase of the program testing. In this case, the unit automatically will reset the power stimulation almost to a minimum and will conduct several measurements of symmetrical paravertebral areas in all parts of the spine. Such several measurements will be made. Duration of this program phase for 3 minutes. The patient should not change power stimulation and lie quietly on the unit. After testing, the unit will analyze the reading and select zone where right and left side of the reading will be maximally different from each other is the latent trigger zone. And then it goes into a third phase of the program E. Alternation frequency of the unit will fix the necessary trigger zone for 10 minutes. In case, if the reading figures are the same in all parts of the spine, such situation, of course, could be extremely rare, but it is possible. In this case, the machine automatically will stop the program. At the end of the program, you will hear a beep indicating the work completion. The patient can also roll off the machine to the couch and, after the program, of course, must relax within 15 to 20 minutes. Thus, we have held the first treatment session in the program E on the new device Denas Vertebra. I want to emphasize that all the new items and all new developments of Denas Corporation have one single purpose: to improve the efficiency of dynamic electro-neurostimulation and hence increase the overall level of our health. The new device of Denas Vertebra fully meets this goal. The studies we have conducted on the basis of our lab and medical department have shown that the inclusion in the formation a new program of stimulation greatly increases the overall effectiveness of the treatment of patients with spine diseases, and there is no doubt that the new device, Denas Vertebra, will make a new chapter in the treatment of such patients. We have laboratory recommendations for doctors, written PhD thesis about the effectiveness of the device in the hospital and at home. We are confident that the introduction of new stimulation program E will greatly increase the effectiveness of the program for diffuse human disease. And, as always, I wish to all distributors and all users of the Denas Corporation well